Yes, ma'am.
Okay. Okay, so good morning to all of you.
Good morning, ma'am.
Good morning,
Good
ma'am.
morning. Good morning. Okay, in the last class, we were discussing on PHC, primary health care. So, please read out the last class. Whoever were present, please read out. Read out fast. Aliza, you were present?
Yes, ma'am.
Read out.
The medical system that are truly Indian in origin and development are the Ayurveda.
No, PHC, primary health care.
Oh, ma'am, I wasn't there.
You are absent. Who were present that
Ma'am.
day? Costa present.
Yes, ma'am.
Okay, you read out. PHC.
Primary healthcare. Following an international conference at the Alma Ata, a new approach to healthcare came into the action, and this is called the primary healthcare. Alma Ata is the conference defines the primary healthcare as an essential healthcare made universally accessible to individuals and acceptable to them through their full participation and at a cost that the community and the country can afford. The principle of primary health care, equitable distribution. First point, the health services must be shared equally in respect of their ability to pay, and all must have access to health services. Second point, the community participation, the involvement of individual families and the communities in promotion of their own health and welfare. The third point, intersectoral coordination, the coordination related sections and aspects of national and community development in the particular agriculture, animal husbandry, food industry, education, housing, the public works, and communication and other section.
Not section, sectors. Sectors.
Yes, yes, one sector.
SACTORS, sectors. Okay. Okay, so this was all about primary health care. Like we have to continue two more points are there. So I think it is clear to you what we have studied in primary health care, that it was a conference held in the Alma Ata. It is an organization, okay, where there will be equality, all the all the people, whether staying in rural or urban areas, will be have to be treated equally, and full participation of the community is also involved. Okay, don't talk. Then in the principles there were equitable distribution, then there should be community participation secondly, and last was the intersectoral coordination. So the fourth point, number 4, you write down appropriate technology. Number 4, you continue with the principles. Number 4, after intersectoral coordination, number 4 is appropriate technology. APPROPRIAT, appropriate technology.
Ma'am, after appropriate technology,
Am I audible?
Yes, ma'am, but volume is low, ma'am.
Okay. Actually, there's a little bit of network issue today. Okay. Write down appropriate technology, then technology with resources that a community and country can afford. Technology with resources that a community and country can afford. Okay, full stop. AFFORD, afford, full stop. So in appropriate technology, what is there? The technologies with resources that a community and country can afford. If you bring too much high class technology and if it is not affordable for the common people, it is useless. So according to the country and according to the community where we live in, so in that way the technology should be brought up. In developed countries, the technologies are more it's more high class, okay, and many things are there that we still do not have but they already have. So it depends upon the country's the development also, whether it is a developing country, developed country, or underdeveloped countries. So in underdeveloped countries there are again some resources and technologies which are present here in developing country, but it might be absent in those countries. So according to the country, the things should be affordable for all the people, because health is for all. Okay, rich and poor, health is for all. So accordingly, there should be equality for all the people regarding health aspect. So now write down last point, number 5. Number 5, focus on prevention. Number 5 is focus on prevention. PREVENTION. Focus on prevention. Underline it, put a dash and write down. Promote health. Promote health. HEALTH. Promote health. Promote health and healthy lifestyles. Promote health and healthy lifestyle. LIFE, lifestyle, STYLE, lifestyle, with emphasis, EMPHASIS, with emphasis on prevention. With emphasis on prevention. Emphasis, EMPHASIS, emphasis on prevention. So, okay, the main focus is prevention. How to prevent disease, how to prevent unhealthiness in our body. Okay, because we know the term prevention is better than cure. You have to, before the treatment, the first and foremost priority, the primary prevention is taking care of yourself by staying healthy, by staying fit, by having nutritious diet. Okay, and how can you maintain health? You all know the definition of health, that health is a state of complete physical, mental, social well-being. Okay, so in all the aspects you have to promote your health. Okay, and good health, healthy lifestyle practices. How, what are the good healthy lifestyle practices? Like, can you tell me healthy lifestyle? What includes healthy lifestyle? No one. Hmm? Healthy lifestyle mane, what is healthy lifestyle? Nobody knows?
I'm having a proper diet, regular
Hmm.
exercises.
Yes, regular exercise, eating variety of plenty of fruits and vegetables, right?
Okay.
Then you should maintain your body weight also. Obesity is not good. Too much fat is not good. Okay. And after having food directly, sleeping is such a bad habit. There are many people, they will eat their meal, dinner, lunch, khalia, pura khalia. After eating, they will just lie down on the bed. Very bad. It is very bad. Okay. So all these things should be avoided. Avoid smoking, drinking alcohol. Many people does that, so it is not good. It is very much unhealthy. Hmm. Then you should do regular exercises. You should go for morning walk. You should brush your teeth regularly, at least twice a day. Taking bath regularly. Drinking plenty of water. So all these are your healthy lifestyle practices. So all this also promotes and prevents diseases. Okay, staying healthy is very much essential. So this is all about the principles of primary healthcare. What we learned in principles of primary healthcare: equitable distribution, community participation. Number three is intersectoral coordination. And number four is your appropriate technology. The last one is focus on prevention. So these are the principles of primary healthcare. Next, you write down the next point: 8 essential elements of primary healthcare. Write down 8 essential elements of primary health care. 8 essential, ESSENTIAL, 8 essential elements, ELEMENTS, elements of primary health care. Underline it. So number one, write down the first point. Number one, education about health problems. Education about health problems. Education about health problems and and methods of methods of identifying identifying, comma, prevention and control. Identifying, comma, prevention and control. Prevention and control. So the first point is education about health problems and methods of identifying, comma, prevention and control. So there are 8 essential elements of your PHC, okay, primary health care. So the first one is educating the people about their health problems. Like in a mass awareness, if we see, there are health camps, health mela, okay, health melas. All these are five-day annual events are done for the common people. They give education about health. They give health tips to the people: how to prevent HIV AIDS, how to prevent against malaria, tuberculosis, diabetes. So in health camps, all the health related issues are discussed with the common people. Okay, that they should get vaccinated. The mother and the child both should get vaccinated. Children should be the baby, the infants should be given dose of polio vaccines are required, TT vaccine, measles. So immunization schedule I will take in some other day, so in that you will come to know. So immunization is very much essential for both mother and child. Hmm. So in health melas, all these things are discussed to create mass awareness on the common healthcare issues with the people. And I told you that day also that it is mainly held in schools, it is also held in colleges, then it is held in healthcare organizations, also in general public. Okay, so all these health melas are for promoting health of the people, for educating them. Okay, because if you go to a rural area, they might not be aware of many kinds of diseases. They might not know the prevention. They might not know what to do, what not to do. They might not know the importance of immunization. So all these things are discussed in health camps, health melas. Okay, so educating about the health is very much essential, and it should be spread to all the people. And for that, you have to know first, you have to identify the disease. You have to identify in a mass of people, like what disease is mainly on focus. So you have to identify, and next you will have to teach them on preventing, how to prevent. Okay, you have to teach them about prevention. Next is how to control. For example, HIV, AIDS. They should know how it should be prevented. What are the things that they can use for controlling and this and that. Okay, so all these things must be shared with the people so that it can create awareness among the people. Okay, so these are education about health problems and the methods of how to identify, how to prevent, and how to control the disease. If a per, if there is unhygienic practices in some places, then they should be taught about cleaning, mm, maintaining hygiene, sanitization. If there is a outbreak of malaria, then they should know that they should wear full sleeves. These are some of the um, measures that they can take. Use of mosquito nets. They should go to hospital. So all these type of things that the people are not aware of, it should be educated to them in a simple language. Okay, you can't go there and you can't speak in some other language and they know nothing. Then your health education is useless. The health education should be in such a manner that people will understand. It should be in a simple language, it should be in the local language so that it can be more understandable to them, and it should be upon like they should be able to consume those things. For example, I told you that they also, for if you go to a certain place in a rural area, and if there is pregnant mothers, lots of pregnant mothers out there, you cannot tell them, no, you eat broccoli, you eat pomegranate, no? You eat apple a day. So it might be difficult for many of the people. Okay, apple and all is very much costly, so it might not they might not be able to, take or afford or such things. So in order for them to afford, what you should do is you should tell them to eat kaskol, the things that are easily available in those areas. Kaskol, banana. Okay, so these are some of the Am I audible?
Yes, ma'am.
Okay, I am having network issue today, that's why. Okay, I think you are clear with the first point. Let me second point you write down, number 2. Number 2 is locally, LOCALLY, locally endemic diseases, locally endemic, ENDEMIC, locally endemic disease prevention and treatment, locally endemic disease prevention and treatment. Endemic, ENDEMIC, endemic disease prevention and treatment, TREATMENT, treatment. Okay, so the second point is treating the endemic diseases and how to do the treatment. First, you will have to prevent, and after prevention, you should take treatment by going to the hospital. So, what are the endemic diseases? Endemic diseases are your polio, okay, measles, chickenpox, smallpox, all these are endemic diseases. Okay, so how to prevent these diseases and how to take the treatment. That was the second essential element of PHC. Third point you write, number 3. Number 3, expanded program, expanded program, expanded program of immunization, IMmunization, expanded program of immunization against major infectious disease, against major infectious disease, INFECTIOUS, major infectious disease, major infectious disease. Okay, so this is the third point, expanded program of immunization against major infectious disease. So immunization schedule should be followed, and it should also be treated in the PHCs, CACs, okay, primary health center, then community health center. In all those places you will get immunization. So you should encourage the people to go for immunization. They should be well immunized, okay, against the infectious diseases. What are the infectious diseases? Infectious diseases are mainly caused by bacteria, viruses, fungi, okay, all these causes infectious disease. Like for example, your HIV/AIDS is also an infectious disease. Tuberculosis is also infectious disease. Measles, chickenpox. Okay, so all these things should be prevented. And how can you prevent the infectious disease? By full immunization. You should be immunized from the time the baby is born till certain age. It should be given. The immunization schedule is there. The people should follow the schedule. Okay, they should not miss any dose. So it should be encouraged. So that is also one of the essential element of PHC. Number 4, you write the fourth point, maternal and child health, maternal and child health, maternal and child health, maternal, MATERNL, maternal and child health, including family planning. Maternal and child health, including family planning. Including family planning. FAMILY, family planning. PLANNING. So both the mother and the child should be well immunized. Okay, the maternal health is very much essential during her pregnancy, okay, even during lactation time. So at that time, the maternal and child health, and both this health is mainly dependent on your immunization. The child should be immunized as well as the mother. Mother should be given two TT doses, TT1 and TT2, okay, at first and second interval. And in child health, the child should be given doses of polio, okay, measles vaccine, tetanus vaccine is there, okay, diphtheria vaccine is there. So all these vaccines we will discuss in next class, including family planning. Family planning is also very much essential, very much important. Okay, a family that is not uh, that is not stable, that is not economically stable, should not go for should not exceed more than two child. Okay, and now it has already been said that only two child norm is already applied. Okay, if you work in any if you work in any government hospital, any government college, any government sector offices, then if you are having more than two child, you can be you you will be dismissed from the office. Okay, you are not allowed to work in any government sector. Okay, all those working mothers, they are not allowed to have more than two child. Okay, and they will also have problem with their uh, identification Harry, your Aadhaar card, PAN card, all these things also they will have problem if they have more than two child. The child will face problem. Okay, so family planning is very much important. If you are economically stable, then also we already know that the population of India, we are already coming in second. Okay, we are world's second largest population. Okay, so that population control should be there. And the measures used for population control, there are various measures. Okay, permanent measures are also there, temporary measures are also there. So all these things should be taught to the rural people, should be spread to the common people, especially all those people who are not well educated, who are illiterate. They doesn't know much about all these things, and because of that they don't have any family planning. They used to exceed more than two. They have five, six, seven, eight children, which is not healthy, both for the mother and the child also. It is not healthy. It's not a healthy practice to have more than three, four children. Three, four, five, six. Okay, it's not good. Both becomes unhealthy. So family planning should be well taught to the people. Next point you write down. Number five. Number five is essential drug arrangement. Essential, ESSENTIAL, essential drug, DRUG, essential drug arrangements, ARRANGEMENT, essential drug arrangement, full stop. Essential drug arrangement. So, essential drug arrangement, full stop. What is essential drug arrangement? Essential drug arrangement is something that provides basic health care to the specific population. Okay, they provide basic healthcare services to the population. Okay, and this essential drug management is also there. They provide selected, they are selected for public health, mainly for the health of the public as a whole. Okay, their safety and efficacy at low price. The drug should be safe they should be safe for all the people. Okay, then it also sees to the efficacy of that certain drug, and at a very low price it should be sold to the people. Sometimes it is even given free of cost. Okay, so that is essential drug arrangement. Next point you write down, number 6, nutritional and food supply. Nutritional and food supply. Number 6 point is nutritional, NUTRITIONAL, nutritional and food supply, food, FOOD, food supply, full stop. Nutritional and food supply, full stop. Number 7, write down the 7 point. Number 7, treatment of common infections. treatment of common infections. Number 7 is treatment of common infections. INFECTIONS. Treatment of common infection. Full stop. Common infections like your smallpox, measles, malaria, dengue, polio, okay, chickenpox. So all this comes under your infectious diseases. So treatment of common infection. Full stop. The last point, number 8. Number 8, safe water supply. Safe water supply and sanitation control. Safe water supply and sanitation control. Sanitation control. Sanitation. SANITATION. Safe water supply and sanitation control. Full stop. Sanitation control means proper disposal of human excreta, okay, in the form of liquid or solid. Okay, so proper disposal of human excreta should be taught to the people. The use of sanitation. Okay, so these are the 8 essential elements of primary health care. Okay, first is education about health problems, how to identify, how to prevent, and how to control should be taught to the people. Second is preventing and also treatment of endemic diseases. Endemic diseases are your smallpox, measles, polio, all this. Third point is about the immunization schedule. Okay, number 4 is both maternal and child health, and also it includes the family planning. Second, the number fifth point is essential drug management. Okay, essential drug arrangement, which provides basic healthcare needs to the population. Okay, the safety and efficacy of drugs at very low prices sold to the people. Next is nutritional and food supply. The seventh point is treatment of infections, common infection. The last is safe water supply and proper disposal of sanitation. Okay, or else you can say sanitation control. So this is all about your primary health care. Okay,
Yes.
understood. Okay, so okay, thank you. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Mm,
Thank you, ma'am.
okay. You all can leave the class.